Controls on dental waste. California, Maine, and New Hampshire require dentists to warn about mercury dangers. My question to the FDA panel is, when will the FDA require all dentists to warn patients about mercury poisoning dangers and the proper methodology and protocols with special techniques and equipment which would reduce 90% of mercury exposure, according to a study published by the Sweden government, and inform the doctors and the public about mercury poisoning from silver fillings, which is the second most toxic non-radioactive element in the face of this earth, as they did for lead. Thank you.
Nice to be here, Dr. Shorn. I am one of millions of Americans who have suffered grave health consequences as a result of mercury poisoning from my dental fillings. My name is Freya Koss. I am the director of the Pennsylvania Coalition for Mercury-Free Dentistry. And I'm here to express my deep concern about FDA's continued suppression of the scientific evidence supporting the serious health effects of mercury dental fillings. In 1998, I was suddenly struck with double vision, drooping eyelids, and loss of equilibrium, and many other neurological effects. And I'd like to show you. If you haven't seen this yet, this is what I looked like 7 days after I had an amalgam filling placed. That was in 1998. 4 years later, after amalgam removal and a treatment of detoxification, that's what I look like. As you can see, I look like I was hit by a Mack truck. I looked like that for 4 years. Based on my symptoms, 5 neurologists diagnosed me with either lupus, multiple sclerosis, which you've heard from several other people today, or myasthenia gravis. In the end, I had myasthenia gravis from mercury fillings. Not one of the doctors considered that my symptoms were or could have been from dental fillings. That's a real problem in medicine today. They don't look at mercury as a possible cause for any autoimmune disease or neurological problem. According to them, there was no known etiology cause of any of these diseases, and no hope that I would get better. In fact, a neurologist at the University of Pennsylvania told me that I better get used to being sick because I was going to be sick for the rest of my life. I rejected those diagnoses, and if I hadn't done my own homework, I wouldn't be here today to tell you the story. At the time, I was unaware that silver-colored fillings were actually 50% mercury, a known neurotoxin. If I had been advised by my dentist that a silver filling was mercury, I never would have allowed that filling to be placed in my teeth. And I certainly wouldn't have allowed mercury fillings to be placed in my children's teeth. But I did. The warnings listed in the material safety data sheet for dental amalgam, only seen by the dentist, never the patient, are frightening. For example, mercury is a pulmonary sensitizer, a nephrotoxin, a neurotoxin, and amalgams are contraindicated for patients with kidney deficiency in children under 6 and expectant women. Parents and expectant women are not told that there's mercury in a silver filling. They sit in that chair and they get those mercury fillings. And they never see those warnings on the material safety data sheet that the dentist sees. I ask you, Dr. Shorn, how is it that FDA continues to officially endorse this toxic product as safe and effective with no risks? Would you condone that filling for your children? The very scientists handpicked by FDA in 2006 and 2010 to evaluate the risks of amalgam have told FDA that mercury doesn't belong in the teeth of children or pregnant women. The same scientists recommended labeling amalgam as mercury, not silver. Yet FDA remains static, taking no steps to educate parents or protect children. In March 2011, the U.S. State Department endorsed a phase out of mercury fillings, asking all governments of the world to protect children and fetuses from mercury. The Scandinavian countries banned amalgam in 2009. Canada issued mercury amalgam warnings for children and pregnant women in 1996. Considering the removal of mercury from pet and childhood vaccines, contact lens solution, mercurochrome, thermometers, thermostats, car switches, and blood pressure machines, when will FDA remove mercury from amalgam dental fillings? If you continue to dally, Dr. Shorn, the children of America will remain guinea pigs and having their health sacrificed to protect the faction of dentistry that clings to this pre-Civil War primitive product. My hope is that you will hear
Thank you.
us.
We need to move on.
Can I just finish the sentence?
Yes.
That's the end. Thank you. My hope is that you will hear us loud and clear, that you will acknowledge the science, and that you will do what's necessary to protect our future generations by banning the use of mercury in dentistry. Thank you.
Dr. Kirk Youngman.
All right. I had a little technical difficulty here and couldn't print. I didn't bring this up here because I'm high tech. So, my name's Kirk Youngman. I'm a dentist. I also graduated from Washington University, St. Louis. I was a class behind Dr. Hardy here. I wasn't bright or brave enough to ask a question about mercury. I just listened to the lectures and got through everything as best I could. But as time would have it, I actually spent time in the public health service at a dental school in Indian Health Service and Migrant Farm Care. So I went through a National Health Service Corps scholarship. So I understand the confines of working in that environment also. But I became interested and cognizant of the fact that mercury in amalgam fillings is a neurotoxin and not just an innocuous ingredient in 1992. I started private practice in 1991. And I'm here to address what I consider the recent lack of regard of mercury as represented by amalgam as a toxic device. I don't know how it's possible that I can add more given all that's been said. and I'm sure many of you may agree with that, but I'll go on since I did drive 2 hours to come here. I do want to emphasize that I feel it's an important distinction to speak of mercury and its toxic properties, which are not ameliorated or eliminated when mixed with metal and implanted into teeth, calling it amalgam, as I had been told as a dental student and dentist. And I'm not talking about what I consider a made-up word for mercury filling called amalgam, and I'm not addressing or discussing anything to related amalgams promulgated innocence of negative consequences as regards local or systemic disease. That amalgams release mercury is why I'm an interested party addressing the significance of its properties as far as it's recognized as a neurotoxin. It is my experience that addressing of amalgam as amalgam is meant to obfuscate it having any causative role in adverse reactions in the body, ignoring the truth that it's a filling emitting mercury, which is the causative agent that is under scrutiny and the true criminal of this subject at hand. Again, amalgams are the source of this known and regulated neurotoxin, and I feel it's important to make this distinction again, as there are those in my profession who make less of amalgam fillings, deflecting the guilt by ignoring or avoiding the fact that they do emit mercury, as is evidenced by the fact that even the dissemination of information to dentists as regards this one simple point, the emitting of vapor, until 1984, wasn't even mentioned by the ADA when they conceded that mercury vapor indeed does come off. The more I saw data, or looked for data that validated this new information, right, that mercury was a neurotoxin actually emitted from mercury fillings, the more that I became interested. So I know you as the FDA are aware of the science and that other speakers have spoken to you at length regarding that science. More people today have also. And it's my opinion that the science has to be being ignored, misrepresented, abdicated to evaluation by people not credible to give scientific importance to it, or otherwise resisted. And for that reason, I'm not going to lay down papers and quote what you already know as it's in your own publications, other than to substantiate, what I'm going to be saying. So what I want to know and will address is that given all the agreed upon scientific truths regarding mercury's properties, its level of neurotoxicity, the fact that it volatilizes at room temperature, its instability and increasing volatility with increasing temperature and agitation as occurs in the mouth, the fact that it's absorbed readily into human tissues and demonstrably creates adverse biological effects on living organisms, and most importantly man, or we're talking about, although I have a huge affinity for polar bears. How is it possible that it's being justified to being put into virtually any and every person in the world's teeth by a dental organization with the specious reasoning that its combination with other metals as a dental filling material renders it safe, because when in fact the justifications for its use is due to its low expense and the fact that it's been used for well over 100 years, ignoring voluminous scientific data for that entire time. I have no idea what that has to do with scientific data or evidence-based research. Not only that, but I've said facts are further obscured by using the word amalgam and negating its causation of disease, when in fact the truth is we're all talking about the emitting and absorption of mercury from a mercury-contaminated filling and the resultant pathophysiology as well as symptomatology observed and identified in any medical publication on toxicity. This obfuscation of the facts and positioning that is taken by an amalgam protagonist is offensive, ingenuous, unscientific, harmful, misdirective, purposely altering the importance of a vitally important issue, and where it limits the public to desired dental and medical care, I feel it's criminal and even inhumane. I'd like to make an analogy to point out the misuse and obfuscation of facts and terms I'm talking about, and that to say amalgam is safe is not unlike a statement of generality that food is safe to eat, water to drink, air to breathe, clothes to wear, or houses to live in. But if the food, water, air, clothes, or houses are contaminated with a known neurotoxin that one is being exposed and contaminated with and in, as occurs with mercury implanted as amalgam, and then to say these things are safe is now not a true statement. To call them safe when they are contaminated with a known neurotoxin and encouraging the public to feel safe using these contaminated items mentioned would be ignorant at best and, again, criminal at worst. The fact that in this instance at hand that the known neurotoxin is an integral and permanent part of amalgam should not justify mercury not being named and recognized as the villain in this mixture, nor justify giving it an innocuous name such as amalgam to deflect and ignore such villainy. Sorry. We're talking about mercury and its causes, known and unimpeachable, and why it should not be protected because it's called an amalgam filling with no known disease causation, and that its implantation in teeth be discontinued in and as a dental restorative material. So since I can't really duplicate and understand the information as a dentist of 27 years, I feel like I sort of need to explain to me as a 12-year-old kid, not biased with my professional education, how, when you're attacking mercury's existence, when I say you're attacking mercury's existence, I mean the FDA, we're trying to limit it in these venues. When you're attacking mercury's existence in air, water, food, and every other article we come in contact with firm regulations and regulatory bodies, how it is you allow the implantation of mercury-laden fillings in the citizens of the United States, either implying or stating outright it is safe in the face of the following. And now I want to quote a few things. The Food and Drug Administration FDA Modernizing Act of 1997 called for the FDA to review and assess the risk for all food and drugs containing mercury. The toxicity of mercury and its components have been recognized since antiquity and are recognized, acknowledged in industry. And then, again, it's been mentioned MS, Alzheimer's, all these things, but when I'm looking at mercury, no difference than when lead is talked about, what's talked about is symptomatology. With mercury, tremors, neuromuscular weakness, polyneuropathy, slurred speech, memory loss, emotional, lability, shyness, fatigue, headaches, insomnia. It's a long list. And I want to juxtapose that with lead, because when lead's talked about, here it is less toxic, and yet it's treated fairly and it's censored due to its known cause of toxicity, evidenced by, I have a following list, which is not dissimilar to mercury. Because lead being irreversible neurological damage, as well as renal disease, cardiovascular effects, reproductive toxicity, and blood levels once considered safe are now considered hazardous with no known threshold, and it being a wholly preventable disease, all of which I feel applies to mercury equally. And again, symptoms of lead, as you know, fatigue, irritability, lethargy, abdominal pain, muscle pain, headache, very similar list.
Thank you, Mr. Kirkman.
Okay.
Carol Stapleman.
Thank you. Thank you for coming and hearing our heartfelt expressions of chagrin. I'm sure this isn't your first rodeo, and you've heard a lot of heart-rending testimonies about the adverse effects of mercury toxicity. Correct me if I'm wrong, but I believe that the role of the FDA is to be our overseer, to be our protectorate, to look at the market, look at what's going to affect us, what we're going to consume, what we're going to have flashed in our eyes, what we're going to be exposed to, and ascertain whether that is safe. And the job of the FDA is to protect us from harm. Research on mercury amalgam is not a new thing. Obviously, it's had 150 years and many, many documentations of why it should not be used. Doctors Vimy, Doctors Haley, Doctors Hardy, there have been so many doctors and so much documentation. Dr. Kennedy has excellent footage of mercury vapor. There's lots of evidence of how it gets into the system, stays in the system, is pernicious, affects many different aspects of us, that it's not stable combined with other metals. It's only stable in glass. And then even so, it's just deadly. It also conducts electricity quite well, as do we. We're roughly 65% water. We're like walking water bags of lightning rods. We're like bags of water with legs, ready to conduct all these things coming off our laptops, our Bluetooths, our technology that's bouncing all over the place. Those things are conducted in our mouth with the kissing cousin to battery acid, which is our saliva. We've got this electrical storm going on in our mouth, just inches away from our brainstem. So there's no wonder why there's so many neurological effects of MS and why it's difficult to name what the problem is, because we are all distinct and individual. Our bodies are all just a little bit different. We metabolize things in a different way, and we're affected by things in a different way. So although it may be dismissive to think of these people with the MS and all these dreadful symptoms as perhaps being hypochondriacs or it being difficult to pin down as what it is, I think that part of what the real question is for me, and the slippery slope and the giant elephant that we're not talking about in the room, is the fact that once the FDA and other responsible bodies recognize the deleterious effect of this on so many people, that there will be litigious, someone's going to have to reach in their pocket and start saying that it's not right, and there has to be some kind of retribution or redress for the injuries that have been caused by this very toxic substance. And I'm wondering why the FDA, although I'm grateful you're here to listen to us, why is the FDA holding these silly and redundant meetings about things that have already been substantiated? That envelope has been closed with a hammer. We know. We don't need another 100 years of research to know that this is not working for us. And I know this is a slippery slope, and I implore you, as do these other kind individuals that have been so deeply affected, to do the right thing. The Turkish have an expression: no matter how far you've gone down the wrong road, turn around. Turn around. And I implore you, protect the interests that you have been so endowed with, and assume the mantle of protection, and let that supersede all the bedfellows, the ADA, the insurance companies that want to use something cheap and no one wants to take the responsibility. Please, please, Dr. Shurin, take the responsibility to say no and start banning the use of mercury amalgam fillings. Thank you.
Ms. Carol Roberts with the Wellness Works.
Thank you to the FDA for listening to us. I'm a practicing physician who does look for underlying causes of chronic illness, which are not taught in medical school. Mercury was introduced to the dental profession in the 1800s by a pair of German brothers, non-professionals, above the initial objections of the Dental Association of the time. The low cost of the material and ease of insertion won over the public, and the quacksilver, the origin of our pejorative term quack, became widely accepted. Since then, the dental profession itself has been most negatively affected by chronic slow mercury accumulation. The extremely high suicide rate among dentists and their early average age at mortality may well be due to the toxic effects of mercury. In the rest of us, mercury vapor is released from amalgams with chewing, brushing, cleaning, and drilling. A hair analysis can easily detect extremely elevated levels of mercury after a dental cleaning. The tragedy at Minamata Bay in Japan brought to the fore the extreme toxicity of acute mercury poisoning, when hundreds of people died from exposure due to a factory that was dumping industrial waste containing methyl mercury into the bay. Still, the more subtle manifestations of chronic exposure have yet to be acknowledged. The inability of most people to efficiently eliminate this highly toxic material leads the body to do the next best thing, to store it outside the bloodstream. We simply did not evolve in a world where mercury exposure is a common problem until the advent of amalgam fillings. Now most of us carry lethal amounts of it around in our heads. It has been shown that a pregnant sheep who receives an amalgam filling in her tooth begins to pass that mercury on to her unborn lamb within a day. In functional medicine, the axiom is the fetus is the toxic sink. We now know that the cord blood of newborns contains upwards of 250 toxic chemicals. Most of these have never been tested for safety, and certainly the combination of multiple chemicals in a newborn is impossible to evaluate. Mercury is the most toxic element that is not also radioactive. It does its mischief by replacing normal minerals and enzymes all over the body, thereby inactivating them, and by destroying components of cell membranes, and is especially damaging to the central nervous system. A few of the multiple, dare one say, mercurial disorders which can be associated with mercury toxicity are the following: allergies, asthma, autoimmune diseases, ALS, ankylosing spondylitis, myasthenia gravis, Parkinson's disease, Alzheimer's disease, anxiety, panic attacks, hypoglycemia, low thyroid function, depression, ADD, learning disabilities, multiple chemical sensitivities, chronic fatigue, fibromyalgia, gastritis, arthritis, bipolar disorder, sleep disorders, colitis, Crohn's disease, anorexia nervosa, bulimia, and yeast overgrowth. Naming, labeling, also called making a diagnosis, is not a substitute for understanding underlying causes. In my own functional medicine practice, I've been testing patients for metal toxicity for 17 years. The ubiquity of heavy metals, especially lead and mercury, is astonishing. These two toxins have synergistic negative effects on the